Not only are government policies actually contributing to the killing of the sick by tying the hands of doctors and prohibiting them from prescribing such proven medicine as hydroxychloroquine for patients, the healthy citizens unaffected by the COVID virus, which the majority are, that's the great majority. Most all you listening right now, you probably were exposed to it, but you don't know about it because it's not going to affect you. But all of the healthy folks face the prospect of mandatory vaccines being placed on them, expedited by warp speed. And that is the plan the White House gave the billions of dollar funded development of a plan shamelessly promoted by globalist Bill Gates and others as the only solution to stop COVID. This threat of a mandatory, unproven, and to this point never ever before developed vaccine that the promoters are saying will be the passport to travel, the approval passport to employment, or to basic living of life, that becomes a major threat to the healthy. So, Twila, we've talked about vaccines on this program before, but start us out here first with why a COVID vaccine is, I've mentioned, both unlikely to begin with, but the problems associated with the warp speed development and the rush to vaccinate the world is actually a dangerous thing.
Right. You know, there have been attempts to get a coronavirus in the past, and it hasn't worked. There have been attempts to get an RSV virus vaccine in the past, 50 years of attempts, and it hasn't worked. HIV, 36 years, and it hasn't worked. 12 years ago, a study came out where they were trying to do a coronavirus, and it was making every mouse that had been vaccinated and then they had been exposed to the real virus, those mice got more ill. They got severely ill. And the researchers in this particular study talked about the fact that they were remembering the study back in 1969, which they did on infants, little babies, for RSV. And they gave these little babies this RSV vaccine, and then the babies who had gotten it, when they were exposed to the real deal, the actual virus, they got severely ill. 80% of those children were hospitalized and 2 died. And so when Fauci told the U.S. Senate, when they asked about a vaccine, Fauci said 2 things. He said there's no guarantee it will work, and then he said, and it may backfire. In other words, it may strengthen the virus, making it more virulent in the bodies of those who have had the vaccine. So this is a reality that people need to understand, and the idea that they could actually, try to give this to people before it's fully proven not to do that, is dangerous. It's dangerous to think about.
Well, it is dangerous to think about, and I think that many, many people under the sound of our voices here today are very concerned about it. I've talked it over with people, as I'm sure you have and others. But at the same time, we realize that there are multiple accounts of vast vaccine tests taking place around the world. It's happening here in the United States. I understand that Vladimir Putin has declared that Russia has achieved a vaccine. Israel is claiming the same, and we could go on and on and on. So just to drop back a little bit, what is the status of the COVID vaccine claims? And I heard what you said in answering Sam's question, but really there are people out there saying, what should we do? What should we believe? Where can we turn? How can we find the facts? So how should people really view these claims of these vaccines that seem to be out there or at least being developed?
I think it's so necessary to be cautious. A lot of people think of vaccines as being something very simple, but there is a long history of dangers and damage due to vaccines. I was just watching something where it showed about some vaccine, I can't remember what it was being used in India, and a whole bunch of people ended up with different forms of paralysis. And so, and in the United States, there is a vaccine injury compensation fund, which is well over $3 billion now that has been spent out of that fund. And that's not to all the people who applied, because many, many, many more people applied for compensation due to injury. These are just the dollars that went to people who were actually approved for it. So vaccine should never be looked at as though, it's like getting a throat culture or something, or an eye exam. It's actually, putting something into your body, which for some people it will be harmless. For some people it may even work. For other people, particularly if their genetics, just deal with it differently, because that's what they're thinking today, is that reactions to vaccines probably have more to do with your genetics than anything. So you might be one of those for whom it would be, very harmful. And so when I listen to Putin, it's kind of funny. Apparently he's never mentioned his children in 10 years of one reporter listening to him. And so he usually doesn't do it. And I thought, well, why didn't he take the vaccine? Why didn't Putin take the vaccine? His child is not in danger. Why didn't Putin take the vaccine? He's in more danger than anyone when you come to look at the elderly with pre-existing conditions. It's be more likely him that would get COVID than it would be his daughter.
And that goes back to the heart of this whole thing here again. You've talked about it. We've talked about it with other guests. God has made the human body with the thing called an immune system. We respond to these things as they come along. And when you artificially do something, as you're saying, stick something into your body, which is a foreign matter, that's the part that you talk about is the unpredictable part. And I think it's probably at the heart of why there is such resistance to people, not against vaccines, all vaccines, but to ones that are rushed along the path. But it does seem that we are on this track. And it does seem, Twila, like many of our governors and others are on track to continue to push now the tracing aspect of testing and the tracing, but that seems to be linked to the vaccination as well. So even with all the things that we're saying here, it still seems like this ball is rolling forward. Do you think that this press to vaccinations as the solution to this problem, do you think that it can be derailed, or do you think that it's just so embedded in the whole system that it's going to come at us and we better be prepared for saying no, or however it's going to be?
I think we need to be prepared, although, and particularly because the CDC says that they've already purchased 100 million vials of a variety of different companies' vaccines. Not just one, but several different companies, 100 million vials. And they said they'll have a lot of souvenirs if the final trials don't prove that it's safe. And so they're definitely headed all the way to the vaccine and to the vaccination. So you have to be prepared. I looked I just was perturbed by the fact that Massachusetts apparently has just said now that all children have to be vaccinated, even though they're not coming back to school. They won't get onto the online school systems unless they can prove they've been vaccinated. And so you can see this drive, and this is for flu vaccination. You can see this drive for the government to mandate whatever the government says you need to put into your body. And this is wrong. And I feel like the vaccine choice, and I don't think it's anti-vaccine, so I think it's vaccine choice. There's a huge vaccine choice movement in this country. People very worried about these kind of mandates. And my sense of the matter is, if it really came down to that, there's going to be somewhat of a war. There's people leaving California who's mandating all of these vaccinations without any parent consent, without even medical contraindications, unless the government agrees that that's a worthy medical contraindication for that child. It's very prescriptive. And so we're getting to a point where, in some ways there's going to be civil unrest at the medical level, because parents are going to, they're going to protect their children no matter what. And so I think there's a battle brewing here, and I think people should be prepared for it.
I think so as well, Twila, and it's been around for a long time in the past, but this has legs that are much longer, it seems, being driven by billions of dollars, far more than other things in the past, and there's just something at the heart of it that, in my opinion, just like what you said, at the heart of it, it is an authority issue where government says, we're in charge. We are in charge, and we're going to force our way on you. because the medical side doesn't support it and the safety side doesn't support it either. So it's got to be more. So ladies and gentlemen, be aware. It's coming like a train down the track. You can see the light on the track. Be aware. And again, we're sharing all of this to help be prepared. To be forewarned is to be forearmed.